question from Cary. She's asking, do you recommend liposuction or surgery for a patient after substantial weight loss? We actually touched on this on our last AMA, so I'm glad you brought it back up, Marie. We have patients in our practice that have gone through procedures. We are now in our practice offering an option, but I think the important thing that we touched on last time before we talked more about it was 6 months following the beginning of your maintenance journey. So when you reach the weight that it's been decided we're going to try to maintain that weight for, 6 months from then, a lot can still continue to change with the body, including some changes to skin and how things fit and just how you feel in general.
Yes, I agree with that. A lot of times you can't imagine it. So you lose the weight, you stick with a plan of diet and exercise and give it a little bit of time to see where your body kind of settles out, because it may look a lot better than you're imagining. So there's the thing about liposuction you need to know kind of conceptually, liposuction and surgery. Liposuction removes subcutaneous fat. And a lot of patients who've lost weight, the issue is not subcutaneous fat. The issue is excess skin. If you lost 150 pounds, for example, in many cases, the problem you're worried about, the excess, is excess skin. There's not a lot of subcutaneous fat. So doing liposuction doesn't fix that problem. You probably need some surgical body contouring that removes some of the skin and then tightens it up. And these are very common procedures for plastic surgeons to do.
And we've had patients who have had them.
That's right. I would want to make sure, another reason to wait at least the 6 months is you got to be sure you can keep this weight off. Once you take that skin off, gain 150 pounds back, you got a problem. So you want to prove to yourself, hey, I'm good at keeping this off too, right? And then we have a non-surgical option that we're offering now, some machines that do this non-surgically, but it's really designed for skin tightening and for subcutaneous fat reduction in patients who've lost some weight or really are dissatisfied for a number of reasons with loose skin and so forth, or at various parts of their body. And we've rented an office space next to our Durham office, and we have some of these very nice machines in there. And you can call for some more information about that. We've got a nurse specialist who handles all that sort of thing, and the procedures are painless. It's very, very effective. But she would need to look at you to determine whether you're even a candidate, and that doesn't cost any money. Okay, you would need to understand, okay, here's what I can expect out of this, and here's the limitations. Because it may be a situation if you have a lot of skin where you just need surgery, and we're not going to try to sell you something that, it's not going to work for your problem.
Right. And there's no judgment for folks who do decide to go the surgical route following their weight loss. I know some people can struggle with the idea of doing a cosmetic surgery, but quite frankly, if you have worked so hard to get your health and your body to a place where you want it to be, and there's just some things that aren't going to be able to be altered without some help from a cosmetic surgeon, go for it. If you're able to do it financially, absolutely go for it. We have a lot of patients who have done it, and they are so pleased that they did, and we are so happy for them.